Hello, I'm Mummiع. In the last video, I mentioned how vitamin D is so important in maintaining your healthy bones, keeping you away from diabetes and obesity. In this video, I'm going to be answering the question why vitamin D is very important in the survival of COVID-19 patients. Let's go. So, what's the thing that vitamin D does that help cure or prevent COVID-19 from happening from the first place? So basically, it's a lot of things that vitamin D does to our immunity. I'm gonna start step by step. The first thing you should know is that we have great cells in our immunity called macrophages. Their job is to engulf the pathogens. It can be viruses or bacteria. They do not throw chemicals at those pathogens from outside. No, what they do is whenever a pathogen is around, they go and engulf it. And as soon as the pathogen is inside, they secrete acids and enzymes that break down this pathogen. When vitamin D is present, it attaches to the macrophages via receptors. As I said in my previous video, vitamin D has receptors to most of the cells of our body. After that happens, the macrophages become more severe. They become bigger in size, they become more ready to attack, more vicious, and that will make them collect a higher number of pathogens than those macrophages that do not have vitamin D. The second thing vitamin D does is that it attaches to the macrophages and allows them to produce three molecules. The first one is cathelicidins, and those molecules act like radios. For example, there's a huge number of criminals attacking a couple of cops. Those cops know that they're not going to succeed in the fight with the criminals. So what do? They call for backup using radios. Macrophages can do the same thing. They call for backup using those proteins called cathelicidins. When they do so, they attract more macrophages to the site of infection, therefore overcoming the number of viruses or bacteria. The other two molecules are NFK-beta and beta defensins. And those molecules are so essential for a lot of functions, but to keep things simple, those molecules contact B cells and T cells, which are specialized cells that are so potent against their fight against any other viruses. They can fight viruses, bacteria, fungi, anything that you can think of. And what's so special about them is that they are the most efficient cells in our immune system that can fight infection. This is because they are so specific. You can think of them like a special ops that are required only for special missions. Another way vitamin D acts by protecting us from viruses is that it closes the gates of the cells that line our esophagus and our mouth and nasal cavity. Why does it do that? So for example, if a lot of people are attacking the castle, as you may have seen in movies, the first thing the guards do is that they close the gates of the castle. Same thing happens with our body. So for example, if a virus needs to attack a cell, it will need to have the attachment of its glycoproteins to the receptors that are found on the cells. But when we have enough vitamin D, the cells will downregulate those receptors, meaning decreasing their number, so that the virus doesn't have anything to bind to. And if it does not have anything to bind to, then there's no way it's going to enter the cells. To understand the third way that vitamin D is able to use to keep us protected from infection is using this scenario. For example, I'm a commander in the army and some criminals entered my city. I'm going to have two options. Either to start bombing the city, killing innocent people and the criminals, or deploying special forces that target only the criminals and nothing else. No innocent people are killed. So the second decision is a wise decision. Similarly, in our body, the virus is presented to a naive T cell. It does not know what to do. It has the option to change to a Th1 or a Th2. I don't want to get into details, but you should know that when vitamin D is present, it's going to make the naive T cell take the right decision. It's going to make it shift more to the Th1, which produces chemicals that activate B cells that will be able to produce specific antibodies that target only viruses and nothing but the viruses. Just like how I commanded special forces to snipe the criminals in particular. In the absence of vitamin D, the naive T cell is going to change into a Th2 cell, which is responsible for allergic reaction and inflammation. This is for your information. In COVID-19, it's not the virus that causes death. It's rather the bad, unnecessary, and the weak immune reaction that causes the accumulation of fluid within the lungs, and this may cause loss of breath and may induce death. It's able to keep you away from COVID-19, depression, obesity, diabetes, and bone fragility, which we call osteoporosis. Take care of yourself and your family, and see you later.